Are you a pharmacist stuck in the grind of 2 hour commutes, endless hours on your feet, working morning shift and evening shift, overnight shift, and that constant feeling of just being burned out? And have you ever wondered if there's a better way to use your degree, your knowledge, your skills, and expertise without having to start over with a whole new career? And that gives you that flexibility and balance to enjoy life outside of work. I'm Stephanie, a doctor of pharmacy with 20 years of clinical practice, and I've been where you are. So, welcome to your Remote Remedy, the show that's here to help you break free from that traditional pharmacy grind and discover the world of remote pharmacist jobs. So, whether you're dreaming of working from home while you're sipping your coffee, or traveling around the world while you work, or just reclaiming a little bit of that time and sanity and energy back for yourself, the show is for you. So, what if I told you that your commute and your in-person job isn't just costing you time and energy, it's costing you your health. So in today's episode, you'll discover about the hidden cost of traditional pharmacy work, how remote work can give you back hours in your day, or even if you don't have that remote job yet, how you can reclaim some of these strategies as well before you get the remote job, and simple ways to transform your health and energy. So, I worked as a clinical pharmacist for many, many years. And my first clinical pharmacist job in a hospital, I would work, the shift that started at 6:30 in the morning, or then the next day I would start a shift that worked until 11 p.m. the next night, and that always kind of flipped back and forth. And I was in my 20s, I'm sure I could handle it, but I never felt rested or like on any kind of routine with my sleep or my eating or any of those things. And I really started to feel it. And actually, in my 20s, got my first autoimmune diagnosis. And then I moved on and did a residency. And then from there, took a clinical specialist role in the surgical ICU. And I that had was always day shift, which was great. So I had kind of a routine, but that was kind of a job that just never ended. I was going in early to work up my patients in the ICU. I was staying late to make sure my patients were okay and to catch up on all my other projects. I would eat my lunch while I worked up patients and checked labs and never really took any type of breaks, more or less even stepped outside. And so that also really started to take a toll on how I felt and my energy, and just kind of not really feeling like really focused and clear all the time, and just not feeling so great. And then it wasn't really until my husband and I started to try to have a family, where I had actually two miscarriages back to back, which was really kind of devastating. Devastating. We did go on to have two beautiful daughters, but I that all led to a second autoimmune diagnosis, which was another kind of wake up call. But I still really didn't know how to take care of myself or what to do. And then so it wasn't ultimately until I went back to work as a working mom for a full year with my daughter was about 3 months old. And I went back to that clinical specialist job where I just felt completely stretched thin to the max, where there was no bouncing back. There was nothing left to give. And I knew I needed to make a change. And I started to make changes really small, step by step. And before I share the exact strategies and steps that I took to help me reclaim my health and time, I want to tell you about my weekly pharmacist newsletter, where each week I share insider tips, resources, and where you can join a community of hundreds of pharmacists already on the waitlist for my exclusive course that actually helps you land your dream remote pharmacist job. So join today and take the first step towards your dream career. And so click the link in the show notes. So here's the thing: goals are just dreams without action. So start being that person you want to be today with just these simple steps. So even if you don't have that remote pharmacist job yet, but you're dreaming of the day you do, and this is what your life is going to look like, you can actually start implementing these steps now, and I'll tell you how. So number one, turn your spare time in the car or your commute, that's 2 hours a day, into your growth time. So you need to have a growth mindset and you need to be learning. And you can use that time to listen to podcasts, audiobooks, whatever it is that you want to learn about and to improve your life. So I spent tons of time listening to books about personal finance that transformed our financial situation. I listened to podcasts and books about health and wellness and mindset and business podcasts as well. And so that wasted time in the car became my personal growth time. And it's has changed my life. And so you could just start today by downloading one podcast and listening, popping in those earbuds and learning something new. Number two, so working from home is great because you have plenty of time to make healthy meals. However, sometimes it is hard to find time between back to back Zoom meetings to actually go and eat those healthy meals. And then you find yourself snacking on whatever you can find in your cabinets instead. So, and if you don't work from home, why wait to eat those healthy meals? You can prep simple, healthy lunches and snacks and bring them to go, just like you would as if you worked from home. I meal prepped and brought lunches for years, most days of the week, because it just felt good. I felt like I was eating healthier meals. It gave me energy. I didn't get that post meal 3 p.m. energy slump that a lot of people get. So try this. Buy a roasted chicken in the grocery store. Or if you don't eat chicken, you could get maybe some tofu or a piece of salmon and a bag of mixed greens and just throw in any veggies you want. Cucumbers, cherry tomatoes, um, chopped carrots, and take a can of black beans, throw half of that in, and just bring your favorite dressing on the side. Pack it the night before. Even if you work from home, get into the habit of just packing your meal the night before. So the next day, when it's lunchtime and you're starving and you're in between your meetings, you can just grab that meal to go. So remote work and working from home also means you don't have to rush out the door, right? But, you could still find yourself into some habits where you just are rushing, jumping right into work. And you need to kind of have a little bit of a transition, a time to, focus on yourself. So if it's either spending 10 minutes writing in a journal or meditating, I like to use the Insight Timer app and I just pop my earbuds in and listen to a 5 to 10 minute meditation while I drink my morning cup of coffee. And it's just changes sets you up for the day of your whole day. So even if you do have a commute still, you could just try tomorrow morning taking 3 deep breaths before checking your phone and build from there. And so making space for what matters most to you. So what's important to you? Is it family time, activities, exercising, going for hikes, whatever it is, you can start claiming that time now, even if you work from home or you don't. So you need to kind of take a look back at your life and your schedule and think about what can you eliminate, so say no to, or remove from your schedule. Do you really need to have that meeting? Can that be better off by being communicated in an email? What tasks can you delegate to your family members, to other people that you can hire? And what tasks can you simplify? So could a monthly house cleaning service free up a Saturday for family time? So I think about it this way: spend money on things money can buy and spend time on things that money can't buy, like your experiences. And making time for connection. So some people say working from home can be really lonely, but I say only if you let it. So yeah, true. We don't have the advantage of being in person and having those like built-in coworkers. But I like to think of it this way: like I can curate who my coworkers are now, but still there are plenty of ways to connect. So there are virtual or in-person coffee chat time. You could walk with a friend on your lunch break, work with your spouse that maybe also works from home. But it's just about being intentional. Maybe at the end of your 8-hour day of working from home, you step outside and head to a friend or neighbor's house for a play date with your kids and drink a cup of tea together, so even if you don't work from home, this is really important too. And connecting with people is also the key to making that transition to your remote pharmacist role. So I love to connect with pharmacists on LinkedIn. I've made tons of great connections. People are so kind and nice there, and it will transform your career. So if you work from home, or even if you don't, instead of evening social media scrolling, use 20 minutes to reach out to someone maybe whose role interests you and connect with them. So, this isn't just about practicing habits, it's about becoming the version of the self you want to be. And so, yes, having a commute and working in the pharmacy has a toll on your health. If it's like me with having autoimmune diseases, or maybe it's insulin resistance, hypertension, high cholesterol, are these things starting to creep in? Maybe your just energy is not what it used to be. Well, I'm here to say it can be. And it's not just getting old. So if you don't work from home, just by aligning your daily actions with that vision of yourself, you're not just preparing for that role, you're actually living it already. And so the job just becomes the natural next step. There are some common challenges to prepare yourself for, like making sure you set boundaries when working from home, uh, having clear, not always being on for your work, and having a structure to your day is really important. So I'm going to leave you with a few questions to reflect on. And so question number one is think about your commute or your in-person pharmacist job and think about what is it really costing you? I mean, obviously it's costing you in terms of money and time, and how is it affecting your health and well-being or your family life, how you're showing up for your family. When I was really stressed, I wasn't the mom that I wanted to be. And now that I work from home and I can take care of myself, I am present for my kids and I'm excited when I get to spend time with them. And it's really transformed who I am. Think about how your health would change, with just having these regular eating healthy meals. And what would you do with that extra 2 hours each day? So this week, I challenge you to track how many hours you're losing to commuting and, that in-person job and what you're losing to all that stress. And then imagine what you could do with that time instead. And I would love if you connected with me on LinkedIn. That's where I hang out, and send me a message and share one change you're ready to make for your health today. And so right now I'm recording this episode in the middle of winter in Vermont. It's amazing, lots of snow. But my skin has not really been enjoying the cold weather up until now. But I recently started using a brand called Imogene & Co. And the products are made by a pharmacist who created her own skincare line. I love them. I find them delightful. And I think you will too. And also really just enjoying finally having a skincare routine for myself. So if you want to check them out and support a fellow pharmacist, here's a discount code for my listeners. It's code STEPH10 for 10% off.